Okay, I'm Melissa,
I'm Patricia.
My name is Jessa.
and this is case study for chapter 60 and 61. Oh, there's effects. Chapter 60 is drugs for diabetes mellitus. A nurse educator is presenting a seminar on insulin to nursing students. What would be the best response to these questions? Why are regular and rapid acting insulins the only insulin administered intravenously? Regular insulin is only given intravenously. However, rapid acting insulin must be administered in conjunction with intermediate insulin in people with type 1 diabetes. It is given intravenously because it is the quickest way to deliver insulin in the bloodstream. If regular insulin is most like human insulin, why do doctors prescribe rapid acting insulin such as insulin aspart or insulin glulicine? Doctors prescribe rapid acting insulin because they are absorbed faster into the body. Rapid acting insulin can be administered before or after eating, rather than 30 minutes before eating. This decreases the risk of insulin not being absorbed fast enough if the glucose in your meal is absorbed by the body first. Rapid acting insulin also decreases the risk of patients getting hypoglycemia because they're able to eat a meal anytime instead of waiting. How is using determere or glargine insulin better than using NPH insulin? NPH insulin has a higher maximum impact than detemir and glargine. NPH has an onset of about 1 to 2 hours after administration and peak time of about 6 to 10 hours, while detemir and glargine have an onset of 1 hour and no peak time. However, the patient is able to feel the maximum strength about 5 hours after administration. It does not last as long. What is the advantage of using basal glargine insulin? Basal glargine is a long acting insulin that should last 24 hours. However, some people feel like this is not true and need another dose less than 24 hours after administration. Due to it not lasting 24 hours, people may experience hyperglycemia before the next administration. Basal insulin has no peak time because it is supposed to achieve blood levels that are relatively steady. Number 5. Some prescribers order basal glargine insulin in the morning rather than in the evening, as the literature recommends. Why would they do this? Basal glargine needs to be administered at the same time every day in order for the patient to achieve a steady blood glucose level. When ordering medication, the patient should always come first, and some patients prefer to take it every morning instead of in the evenings. Number 6. Patients sometimes need both basal and bolus doses of insulin at the same time. What could happen if the basal detamir or glargine insulin is mixed with a bolus of insulin aspart and other rapid or fast-acting insulins? If basal detamir or glargine insulin is mixed with a bolus of insulin, the bolus insulin can alter the chemical structure of the basal insulin, reducing the mechanism that retains the slow absorption rate. The dose of basal insulin could be absorbed quicker than intended, causing hypoglycemia in the patient, which may be critical or fatal. Number 7. What should the patient or nurse do if a vial of insulin aspart is cloudy? NPH is the only cloudy insulin. All other insulins are clear. If cloudiness appears in a non NPH insulin, then it must be discarded. NPH insulin must be rolled to mixed particles, not shaken. Shaking it can cause the insulin to become clumpy and have unnecessary air bubbles. What is inhaled human insulin used for? Inhaled human insulin is a mealtime insulin product that can be used in people with type 1 and 2 diabetes. It is inhaled at each meal. And then, chapter 61, Drugs for Thyroid Disorder. A 30-year-old woman visits her family physician complaining that she has been experiencing unusual fatigue, lethargy, intolerance to cold, and weight gain. At the visit, her vital signs are BP of 150 over 58 mmHg, pulse rate of 62 beats per minute, a respiration rate of 16, and temperature was 97.8 Fahrenheit. What thyroid disorder do these symptoms suggest? These symptoms suggest of hypothyroidism. Hypothyroidism is a mild deficiency of the thyroid hormone. What laboratory test results would the nurse expect to see for this patient if she is hypothyroid? The nurse would expect to see elevated thyrotropin level, low levels of liothyronine and levothyroxine. Number 3. After appropriate history, physical examination, and laboratory studies, the patient is diagnosed with primary hypothyroidism and started on levothyroxine 112 micrograms once a day. What teaching should the nurse provide about expected timing for relief of symptoms? Levothyroxine starts working right away. However, it may take several weeks until the patient starts to feel any symptoms of relief. Number four, what teaching should the nurse provide to this patient about administration of levothyroxine? Levothyroxine should be taken on an empty stomach in the morning, at least 30 to 60 minutes before breakfast. This is because the absorption by mouth of levothyroxine is reduced by food. Number five, the nurse should teach about possible adverse effects of levothyroxine. What adverse effects warrant notifying the prescriber? If levothyroxine is taken in its appropriate dosage, it is rare for adverse effects to occur. However, if an acute overdose occurs, thyrotoxicosis may be the result. Signs and symptoms of thyrotoxicosis include tachycardia, angina, tremor, nervousness, insomnia, hyperthermia, heat intolerance, and sweating. Chronic overdose will cause accelerated bone loss and risk of atrial fibrillation. Number six, the patient tells the nurse that her sister has asked her for some of her thyroid pills to help her lose weight. She wants to know if this would be a problem. How should the nurse respond? Treating hypothyroidism may help the patient lose weight, however, that is not its intended use. The medication is being used to treat hypothyroidism, which will increase thyroid hormone levels. If the patient's sister takes the medication, unnecessary results may happen to her, such as an overdose because she is not diagnosed with hypothyroidism or developing hyperthyroidism. Number seven, the patient returns for her 1 year checkup. She wonders if she still needs the medication because she sometimes forgets to take the drug and does not feel any different on those days. How should the nurse respond? Loss of therapeutic effect is very slow. It might take several weeks for the patient to notice a difference. Taking medication for a thyroid disorder is a lifelong treatment plan. If medication is ceased, symptoms will likely occur again. This is the second part. So, propanol 10 milligrams and propylthyroracil 100 milligrams 3 times a day are prescribed for a 25-year-old woman who was recently diagnosed with Graves' disease. Number 8. What laboratory results would the nurse expect to see when reviewing this patient's chart? The nurse would expect to see low TSH levels and elevated T3 and T4. They would also see an uptake increase in radioactive iodine and elevated thyroid stimulating immunoglobulin levels. When you're diagnosed with Graves' disease, your immune system is unintentionally producing the antibody TSI. Number 9, the patient asks the nurse why two drugs have been prescribed. What information should the nurse provide regarding the need for both drugs? Propranolol can suppress tachycardia that may be caused by Graves' disease, and propylthyroracil is used to treat overactive thyroid. Number 10, the drug methimazole is less toxic than propylthyroracil. What would be a possible reason why the prescriber chose propylthyroracil for this patient? Possible reasons for this prescriber choosing propylthyroracil over methimazole are: the patient will want to get pregnant and PTU crosses the placenta without harming the fetus in the first trimester, unlike methimazole. But methimazole is preferred during the second and third trimester. Another possible reason is that PTU blocks the conversion of T4 to T3 more effectively than methimazole does. Number 11. What assessments should the nurse teach the patient to monitor, and what findings should be reported to the prescriber? The nurse should teach the patient to monitor their pulse and weight. They should report any findings of tachycardia or palpitations, lack of weight gain, fever, sore throat, or any signs of infection. Number 12. 6 months later, the patient's heart rate, blood pressure, TSH, and free T3 levels are within normal limits. The prescriber provides a plan for gradual decrease, then discontinuation of propranolol. Why was this drug dose tapered rather than discontinued if vital signs are normal? Abrupt discontinuation of propranolol can lead to propranolol withdrawal syndrome after being on the drug for a long time. The drug is gradually decreased to avoid this. Tachycardia can also occur if the drug is suddenly discontinued. And that is the end. Thank you.